today, Dr. Hussain Bashkolachi YouTube channel is continuing with the Community Medicine and Public Health Lecture Series for the MCPS, MPH, MSPH, MPhil as well as PhD and MBBS and nursing students, dental students, or anybody who is interested in the community medicine, in the preventive medicine and social medicine. Our video is watched not only by my students but the students from other universities and even the people from other countries, particularly India, USA, USSR and other countries are also visiting my channel, and their views are there, and we are thankful for that. And if you are new on this channel, please subscribe it, like it, share it. As it was told by one of the Egyptian scholar that today's currency is not dollar and rupees, but it is the subscriber, share and likes. This is your economy and whole world is going on that. So next please. The topic once again was, just show me. You can see that a woman is crossing from the river through a kind of steps. So this study is also called case crossover study. Just like this picture is giving you a visual image that how studies are also crossing certain steps and certain periods and certain milestones, and there are different names. Yes, this is another that how if you are not properly handling the situation, your study can be a wrong study and you can also have a different kind of other things. Then coming to the definition and design of the crossover study, it is related to prospective crossover design. It is a future study, but it is a different kind of study. It is a matched case control study, and when we say case, it also looks back, though it is a prospective study, but it looks back at study and involves cases only, and each individual serves as his/her own control. In the previous yesterday's talk, we discussed about the case cohort study where the control are selected in the start of the study, but here the case is its own control. That is the main difference in this study. The data from a case over design can also resemble cohort data. Cohort data, you can see that this will look like a cohort means forward looking study, and if the control data are units of person in time, this is first time that we are using instead of person the person time. So next to that is another view of a crossover situation. You can see that how this girl is crossing from a different angles, turns, steps. So our study will also have a different drum. In the next video we will show you the case crossover design. You can see that exposed control period, and then exposed risk period, and the event period. You can see that this green, this red and this black. So how study is moving from exposed period, from risk period, and then the event period person is sick. So this is actual diagrammatically, and you can see a person compared to yourself routine. You are moving. Did you do any unusual activity? Suppose your cycle or your brake is failing and ultimately you got an accident, and that kind of short exposure, small situation, and the small event or the event, that kind of situation is suitable for this crossover study, where cases are also their own control. Yes. This is another picture. You can see that the alcohol consumption and the traffic injury and midnight, midday, midnight. So these are the situations where in 24 hours, if injuries are there, then the alcohol consumption and cannabis consumption and injury is studied. So you can see that you have drunk, you move and you get the accident. Same way you are user of cannabis, you move, you get the injury or accident. Case control versus case crossover. From the topic listed below, you can see that the body mass index, endometrial cancer, case control, and you can have here cell phone calls and car accidents. Here you will use the case control method, but here the cell phone calls, because a person is driving and using the phone call, and you will use this crossover. And in other family quarrel and injury or stroke, you will use the crossover. And the last is cocaine use, myocardial infection, you will use the case crossover study. Next please. This is another way of giving you that how the case crossover study is mentioned in this diagrammatic, and the problem can occur very in short duration, so the hazard period and the event period both are equal. Next. This is another visual picture just to entertain you that the crossing is part of life, but here we are discussing the crossover study, which is a scientific and research study in community medicine and public health. So the objectives are already described, the concept and overview, and illustrate the limitations of the study. Next. Case crossover design is a scientific way to ask and answer the question that was the patient doing anything unusual just before the onset of the disease or event. So you are asking same question from the same person to understand 1 hour ago unusual activity and disease or accident or event. Next. So this is another I am sick. Did I do anything unusual? Here and just this word is unusual before the illness, and then you will compare with the routine or that situation. Next. Once again the same thing is the control, yourself, you are the control, but here the word it's very clear, and you must remember hazard period and control period. Event does not occur is control period, and event has occurred, it is hazard period, and most you can see both are equal. So within a 1 hour, the attack after 1 hour, and it will last for 1 hour. So both are equal, and same person, he was doing some wrong thing or exertion and developed the heart attack. Next. Another case crossover design is already mentioned that it is a matched case control study, but involves case only, and each individual serves as his or her own control. So the same case is also a control, because same information is utilized for understanding the problem and can also resemble the cohort data. So next please. So this is, I think, beautiful picture. It will show you that the event onset, exposure, and then the control period. So here is no hazard and here is a hazard or event. So it looks just like as, and you can see that ultimately the hazard comes to this period, and the study name is crossover design. Next. Effect period of exposure. This is another term used. Period of altered risk in a population to be difference between the minimum delay before impact and the maximum carryover time. So it is the time, minimum time which is in the delay, and then the carryover time are streamlining the things. Next. Effect period of the exposure. Effect period, and then once again the effect period. So the delay, if you are here and there is a delay, then the effect period will have a different meaning. Next please. Hazard period. This is important. The period of time right before the onset of the event. We are continuing with this hazard period, and you can see that the length of the effect period and thus the hazard period can be decided empirically, means from your own judgment. There is no such rule. However, this length is critical over estimation or underestimation of the duration will dilute the association. So if you have wrong calculation of the effect period, your study can have a result which will be to some extent not as correct as we desire. Next please. Control data can be one exposure information and exposure information in the past according to the individual's usual frequency of exposure. Here the information from a comparable time period. So next. Then triggering of myocardial, this is the example. Here you can see that the heavy physical exertion and myocardial infarction are heart attack. 1 hour before there was a heavy exertion by a person, and after 1 hour the hazard started, and 2 sets of control data were used. This person is same, the exertion is done by the same person and the MI suffered is from the same person. Next. And here you can see this is the 1 hour. These are the some dates and MI development. Physical exertion and MI to some extent simultaneously in that period was occurring and person was not knowing. The physical exertion information from 1 hour period at the same time may be before the onset of the MI. Next. This is same situation, hazard period and physical exertion during hazard period. This you can see that the MI is there, but amount of person time exposed to physical exertion over the past 1 year. So it is another type of the physical exertion which where we use the person time. Person time means exertion time in each year or each month or each day is combined, and ultimately this is exertion time and this is the MI. So we can use person time also as a denominator. Next. So this is a 2x2 table, and you can see that the hazard period, it was exposed, unexposed, control period when the hazard were not there. So this is A, B, C, D, odds ratio will be B upon C. Next. And here you can see that if there was exposure in hazard period, then 1 ratio 0, and if there was no exposure in hazard period, then 0 ratio 1 is mentioned. Calculate the concurrence observed odd ratio or A ratio B. We will see in the next table. Next. Yes. So this kind of analysis is done in the crossover study design, and you can see that the second calculation is calculate the concurrence x square expected odds ratio. Here expected xy and odds that random event or disease or accident injury would have fallen in the effect period after an episode of the x square. So this is a concurrence expected odds ratio. Go back. Yes, this is AB and come down. This is XY. Let us see how the calculation works. So here you can see that the length of the effect after exertion 1 hour and frequency of UL exertion 2 hours per week or 2 per week, and you can see these are the weeks, these are the days, and this is minus XY 2 into 365, and then this is the total hours. Next, and ultimately you will have a risk ratio. Calculate the risk ratio observed AB, and you can see that A upon B, Y upon X, expected odds XY and observed odd AY, and then there is a calculation, and you can see that there is a kind of numerator is X and denominator is X. Numerator is y1, which is here, and numerator denominator is x1, which is here in our situation. Next, please. So this is a kind of calculation, and ultimately you can calculate the risk ratio. You can see 20 upon 90. These are in the numerator, and 8, 5 and 12. These are in the denominator, and the calculation goes on. Next, please. So crossover design can only be applied when the time lag between x square and outcome is brief, and the x square must have little carryover effect. The result, that's why this is called a crossover study also. The result of this analysis are short-term risk rather than cumulative risk. Next, please. So discussion, we recall bias is there, and within the individual confounding factor, stratification and other things can be there, and we need a logistic regression. Next, please. So this is the end of the presentation, and once again I am summarizing that the crossover study is very useful where the risk and the event has a very short duration, and you can use the same person case as its own control, and you can calculate the hazard period as well as the control period or non-hazard period, and you can use the formula and odds ratio, and ultimately you can calculate the risk ratio. And this study is useful for the short-term risk and short-term carryover period. That's why it is called crossover. This is a kind of case control study, and it is very close to the nested case control study which we discussed yesterday. We shall continue, and if there are any questions, any comments, to understand this, we have utilized the material from Google, from other people. They have developed these kinds of slides and other things, so we are thankful to them, and the students of the MCPS, FCPS, MPH, MBBS, MSPH and PhD are encouraged to watch this video, and if there are any improvements and if there are any queries and questions, we shall be happy. From the Isra University and from Dr. Hussain Bashkolati YouTube channel, I once again thank you. Please like it, subscribe it, share it. Thank you.